So I consider August 24th to be almost my rebirth, birthday, if you will. I went through, so growing up, having achondroplasia, I knew that a particular procedure was always an option for me called limb lengthening. And I can go into as much detail as I can as someone who's not a physician and who doesn't, actually perform that treatment and share about it. But basically, it is a controversial procedure in general for those with achondroplasia or dwarfism. I was 16 years old. I was at my, for achondroplasia, I was at my full grown adult height, which was 3 feet 10 inches tall, which I don't have like a good idea to compare that to. But today, after going through 2 leg lengthenings, I am now 4 feet 11 inches tall, which for me is a world of a difference. But the reason that August 24th is what I consider almost my second birthday, is because that was the day I had my first surgery for it, or for lengthening, the first, step in that, I would say, journey. It is uncommon, it's rare, it's very controversial because a lot of people within the dwarfism community feel like, oh, you're not happy with being in your own body. You feel like you need to be average height and fit in with everyone else. And that's not why I chose to go through it. I mean, when you look at it, externally and you see the transformation that I went through, I mean, yes, people see physically, if they're looking at pictures, they see a girl who was short, 3'10", had bowed legs, and now they see a woman who's 4'11", longer legs, straight legs, and longer arms, and that's what they see, and like that's all they see. Always helping me always needing to ask for help, me not being, I was 16 years old. I couldn't just, like, I was not in a place where I could just run into the store for my mom and get something she needs, knowing that it's on, whatever shelf that I know I can't reach. I mean, yes, there are many adults with achondroplasia who obviously live their life doing that, but, just for me, like, that's not what I wanted. I'm not tired of so many things that I knew limb lengthening give me, you know, would give me what I was wanting. I wanted to be able to just go to a store and buy clothes off the rack without needing to hem them. I wanted to be able to have face-to-face conversations with my peers because a 90, I would say 99, ironically not now, but 99% of my peers are people of average height or average stature, however we want to say it. And I always did have this, sense of discomfort when I'm just like, okay, I'm a girl who's 3 feet 10, and here I am in a room, or, with men or with women, whoever, and I'm just like, my face is at level with their crotch. Like, the average achondroplasia male can be up to 4 feet 10 inches tall. And so I always tell people who, you know, get upset with the fact that I went through lengthening, I always come back to, I'm like, you realize I'm only 4'11". Like, it's not like I went from 3 feet 10 to 6 feet tall. Like, I'm just 1 inch above, like, the average, I guess,
Yeah.
tall height for achondroplasia. And especially for achondroplasia, our a lot of our facial features are very similar. We kind of have the prominent
Mm-hmm.
forehead, we have a depressed nasal bridge, and that's just very common. And so I think that also, still gives it away. My hands and feet are still fairly small. I mean, they're not going to grow anymore, but they're, there's definitely been times where I know people have looked at me and be like, does she have dwarfism? Or is she just like really short and looks like she could have dwarfism? And so I always tell people, I'm
Hmm.
like, I do have it. I just have longer arms and legs than every physician that I know who performs limb lengthening specifically for skeletal dysplasia, dwarfism, achondroplasia. They're all, similar. They're not just going, they know, they understand that this is kind of someone with achondroplasia going through this, or dwarfism, there is controversy that kind of goes with it. And they always make sure that the patient is and understands the commitment needed to go through this and understands
Hmm. Yeah.
that they're fully committed 100%. My doc finished high school. I lengthened my arms and lengthening your arms, it's so easy. You're not like your restrictions when you're lengthening your arms is like, please don't carry your laptop or a heavy plate or pick up things heavy or put whatever. Lengthening arm lengthening is honestly such a breeze. It's ridiculous. 4'5.5" to 4'11" was world of a difference. Like 3'10" to 4'5.5" was a big difference. But the last lengthening, I mean, really, it just was like, oh my gosh, like it was unbelievable, and it was just amazing. And I know so many people who only have done one leg lengthening, and they're so happy and satisfied. And so it's all about just what you want and your best, what's best for you.
Hello, welcome to my blog. To my fun Joe Suits. I am Joe Suits, and I'll be giving my to Chandler. Chandler has achondroplasia, a common form of dwarfism. Chandler is in a unique situation since she went through limb lengthening treatment to treat ailments and of course to get taller. But before we dive in, imagine there is a button, and if you press the button, all your diseases would disappear. But a random person had to die. Would you press the button?
I don't know. Repeat the question again. I'm so sorry. I,
Sure, sure. So imagine there is a button. If you press the button, all your diseases would disappear, but a random person has to die. Would you press the button?
I would not press the button. Granted that I, if I'm, if it's like today, and knowing what I know about my condition, my rare condition, and all of the things and what have you associated with it, I have been managing it well for decades now. And, I know how to manage it. I know how to advocate for others to help manage it, their own, their, if they have achondroplasia as well. And so, no, I would not press the button, I don't think, just because, you know, I don't think someone should lose their own life just because, if I'm having a bad day with, you know, my condition, but I don't know. So I wouldn't press it.
What if there were? I feel like there are more bad people than good people, so the chances of a bad person being eliminated would be enticing, maybe.
Sorry. Why is he so barky? I
So he agrees with me.
I don't think I would press it. I still
Okay.
don't like even if they were.
I guess the question is, I feel like there are more bad people than good people, so you still wouldn't press the button since the chances of a bad person dying is higher.
I mean, if I knew it was a bad person, then maybe, but I would have I am guilty of being very much of a people pleaser, and I do care about people regardless of if they care about me in return or not. And so I think I would just have, I would feel, I think it's every human's right to have their own selfishness when it comes to certain things, but I think, if it meant, even if I would benefit from it, if my physical body would benefit from it greatly, but I would still have the, emotional guilt and everything, I still don't think I'd be able to do it just because I would feel so guilty and, feel like, even if they are a bad person, I still feel like karma would come back around and bite me. And so I still, you know, would I consider it? I don't, but would I
you're
actually
definitely gonna
go?
think about you're definitely gonna think about it like 2 in the morning.
Yeah, it's definitely a 2 a.m. It's definitely a 2 a.m. thought and not a 10 a.m. thought. That's true.
Oh, okay, I respect your opinion. I respect your opinion. So let's talk why August 24th is a special date for you.
So I consider August 24th to be almost my rebirth, birthday, if you will. I went through, so growing up, having achondroplasia, I knew that a particular procedure was always an option for me called limb lengthening. And I can go into as much detail as I can as someone who's not a physician and who doesn't, actually perform that treatment and share about it. But basically, it is a controversial procedure in general for those with achondroplasia or dwarfism, or even those who actually don't have skeletal dysplasia but might have a limb length discrepancy, meaning they have one leg shorter than the other, one arm shorter than the other, what have you. It's kind of just an overall controversial procedure, but there really are so much benefits that come out of it, and both, I would say, for sure, medically, health wise, but also just personally. And I decided to go through it because I was 16 years old. I was at my, for achondroplasia, I was at my full grown adult height, which was 3 feet 10 inches tall, which I don't have like a good idea to compare that to. But today, after going through 2 leg lengthenings, I am now 4 feet 11 inches tall, which for me is a world of a difference. But the reason that August 24th, is what I consider almost my second birthday, is because that was the day I had my first surgery for it, or for lengthening, the first, step in that, I would say, journey. And it's just ever since then has just been such an important day for me. Every year it comes around, I just feel the need, feel the need to just celebrate it and acknowledge it more so than when you, like, when patients I know who go through lengthening, again, whether they have dwarfism or have a leg length discrepancy, sometimes they more so consider because you have these like external devices on your body for several months, and sometimes they'll
Yeah,
consider like that the day you get the fixators, is what they're called, like the day you get the fixators removed, I feel like is when most people consider that to be kind of their like celebration day, which I
yeah,
did.
it's a
And
huge deal.
yeah, because you're done and it's over. And I loved, I remember that day. It was some day in April, but I can't remember like exactly actually.
Let's talk about the limb lengthening. So I'm not familiar with the dwarfism community. Is it is this like a common surgery for dwarfism, or is it something that kind of, because I know this Well, I don't even know if this surgery is rare, but like, is it just an uncommon practice for dwarfism community?
It is uncommon, it's rare. It's not, it's very controversial because a lot of people within the dwarfism community feel like, oh, you're just, you're not happy with being in your own body. You feel like you need to be average height and fit in with everyone else. And that's not why I chose to go through it. I mean, when you look at it, externally and you see the transformation that I went through, I mean, yes, people see physically, if they're looking at pictures, they see a girl who was short, 3'10", had bowed legs, and now they see a woman who's 4'11", longer legs, straight legs, and longer arms. And, that's what they see. And, like, that's all they see. They don't, I don't think, realize, for me, they don't see the fact that, hey, I can now touch the top of my head. I can now, with having longer arms, I can now, one, sit up straighter because when you're lengthening your arms, you're only lengthening the humerus. But there's just a lot of, when people see my before and after photos, they're really only seeing the before and after. They're not seeing a lot of the what in my life actually changed. And for me, when I was 16, I was just at this point where, I was independent, but I was still very dependent on society and people, always helping me always needing to ask for help, me not being, I was 16 years old. I couldn't just, like, I was not in a place where I could just run into the store for my mom and get something she needs, knowing that it's on, whatever shelf that I know I can't reach. I mean, yes, there are many adults with achondroplasia who obviously live their life doing that, but, just for me, like, that's not what I wanted. I'm not someone who, one, I don't like asking for help. I find it, people may find this hard to believe. I don't like drawing attention to myself when it's not, I don't like drawing attention to myself unless I'm like purposely doing it. You know what I mean?
I
I
get it,
don't
yeah.
want attention on me, without my consent, I would say. And
I get it.
I and it's just like I was very frustrated and I just was. So, and also, I was physically in pain with my bowed legs, with my back, with everything. I was just at a point where I realized, I realized at 16 years old, you know, I was like, I don't want to go to college like this. Like, I don't know how I could live. And again, it was just me personally. I was thinking to myself, I don't know how I could live in a college dorm feeling this way about, how I feel about my body and everything physically and pain wise. And so I just knew, I knew limb lengthening was an option for me. I knew it was very controversial, but I was very educated on it. I was very, my parents and I always made sure we were so well informed about any treatment options or opportunities specifically, that could benefit me. And so I just decided to go through it because I mean, I was tired of one, I was just tired of so many things that I knew limb lengthening give me, you know, would give me what I was wanting. I wanted to be able to just go to a store and buy clothes off the rack without needing to hem them. I wanted to be able to have face-to-face conversations with my peers because a 90, I would say 99, ironically not now, but 99% of my peers are people of average height or average stature, however we want to say it. And I always did have this, sense of discomfort when I was just like, okay, I'm a girl who's 3 feet 10, and here I am in a room, or, with men or with women, whoever, and I'm just like, my face is at level with their crotch. Like, it was uncomfortable for me. And, like, that's just how it was for me. And that's how, and, it's definitely, limb lengthening is definitely something that's and within the dwarfism community, definitely something it's very controversial, but I think
I mean, I don't know if it helps you, but like I approved the surgery. I don't know the risk and obviously the benefits, but I don't know like the risk and stuff. But I approve of the surgery. Like, why not?
yeah, like, I mean, it comes down to the individual, and I never, people who are against it, even people who don't have dwarfism, who are against it, are very like, oh, you you had lack of confidence, you were not confident in yourself, you were XYZ, and I'm like, it takes a shit ton of confidence to go through something like this. Like, it really does. And knowing every single person I know who has gone through this, I mean, it takes a lot of confidence to say, hey, I want to go through this. And it's not a matter of, giving up and, being like, oh, you should have just, like, whatever, accepted yourself more and accepted your diagnosis. I've accepted my diagnosis.
Fuck that.
Yeah, I've accepted my diagnosis my entire life, and if I have something, if one thing, or I guess three things, since I had three lengthenings, if there are three things, that I could do that would just, you know, give me, satisfy me and give me the body that I want, I mean, I'm gonna do it. I am more active at 30 than I was at 16. I love my body that I'm in now, and I mean, it's true. I mean, I know everyone, I think, goes through moments in their life where they don't love their body, and then the next day they do. But for me, I just knew that I did not want to be in the body that I was at 16. I did not want to be in when I was 30. And I mean, I know I would say every individual in the world, regardless of if they have a disability or anything, you're not in the same body at 30 that you are at 16. But, in this instance, yeah, it's a very kind of different, I would say, take on it. But it was just, I
Yeah.
knew the benefits.
I mean, your surgery is very like unique in that it's an actual benefit to your whole life. Like if you get like, let's say, breast implant, yeah, it might make you look better, but not a very. It doesn't like help you in any physical way really,
Right.
except I guess getting more guys. But like you have a physical, you know, a physical new advantage, I guess. Like like you say, you can reach your head before, and then like reaching the shelf. So like, I guess the question is now, can you dunk?
Can I, I don't know if I know what that
No,
means.
dunk like dunk at basketball.
Oh, I honestly never could. I was a dancer.
Oh man,
I was
you need a refund.
I was a dancer. I never have had any interest, and that's one. Ironically, that's always something people are. I feel like, especially like people with dwarfism, they're always like people who aren't, who want to know more about it, whether it's somebody with dwarfism who's gone through lengthening or not. There are so many questions about like how active they are when it comes to sports. I'm like, I like, because I've had people be like, well, can you like do like how are you with sports now? And I'm like, I I never played sports to be. I mean, damn.
I mean, your personality doesn't really change much. It just improves your day-to-day stuff, like grocery shopping.
Yeah, and
It,
driving,
it's not like you.
drive with no
Yeah.
adaptation. I mean, I will say, so I'm 4'11". My mom would wish, I know my mom does wish that I would drive with pedal extenders because I do still sit a little too close to the steering wheel.
Um,
But I am definitely at a safer distance from it than, I'm still at a pretty good distance from it, but, in my mom's eyes, I definitely still sit too close to it. But same as any other 4'11", 5-foot woman sits close to their steering wheel. But I mean, yeah, so much going through lengthening, so much changed in my day-to-day life, and yeah, I just like I could never not have gone through this. Like if I could do it all over
So,
again, absolutely.
so are you like not like I don't know like the specifics of a dwarf. So are you like now not a dwarf anymore? Are you like a super dwarf? Like how do you categorize yourself
I,
now?
I still have dwarfism. Like, I still have dwarfism, and I
Like
am
ish though.
so.
Like
I was actually just reading this yesterday for something else. So the average height for a woman with achondroplasia is like 3'11" to 4'2", 4'5",
oh
I think. I'll have to don't quote me on it. But I know that the average height for a male with achondroplasia can be up to 4 feet 10 inches tall with no
oh that's
like
high. That's like
yeah.
as I told you.
Yeah, so with no treatment, with like no limb lengthening,
Oh.
nothing, the average achondroplasia male can be up to 4 feet 10 inches tall. And so I always tell people who, you know, get upset with the fact that I went through lengthening, I always come back to, I'm like, you realize I'm only 4'11". Like, it's not like I went from 3 feet 10 to 6 feet tall. Like, I'm just 1 inch above, like, the average, I guess,
Yeah.
tall height for achondroplasia. And, and I will say I have measured at 4'10" in some doctor's offices with their scale, and I'm always like, no, I'm 4'11", but whatever. But, it's I always kind of come back to it. I'm like, I'm only 4'11". Like, I am still very short. Like, I am still so short at 4'11". And so, I'm not even at the 5 feet mark. And I don't ever say I'm 5 feet tall because I'm like, that's cheating. Like,
You can lie about your height. No one can measure.
right.
You're good.
But no, it's so 4'10". Someone with achondroplasia can be 4 feet 10 inches tall without going through any sort of treatment. And so I'm always just like, whenever I get slack or anything for it, I'm always just like, but y'all realize that I'm only 4'11". Like,
I mean, I'm.
yeah.
Can people tell you got limb lengthening? Because I like is every like so you say like before you had like bowing legs. So like, does all dwarfs have bowing legs? Like, can someone just tell you have limb lengthening, or they just see you as a regular
I would
4'10"
say
person?
definitely people with dwarfism can immediately tell. I've definitely
Oh,
had instances where like I've told somebody like, "Oh, I have dwarfism," and they look at me and they're like, "But you're like," they're like, "But you're short, but you're not like that short." And then I go into, "Well, I had
yeah.
limb lengthening," and then it's an educational moment. And so, I mean, there have been instances where I have actually said to somebody, like, just, I don't know, mentioning it in conversation, and they're like, oh, okay. Like, just kind of finally putting the two and two together. And I will say, especially for achondroplasia, our a lot of our facial features are very similar. We kind of have the prominent
Mm-hmm.
forehead, we have a depressed nasal bridge, and that's just very common. And so I think that also, still gives it away. My hands and feet are still fairly small. I mean, they're not going to grow anymore, but they're, There's definitely been times where I know people have looked at me and be like, does she have dwarfism? Or is she just like really short and looks like she could have dwarfism? And so I always tell people, I'm
Hmm.
like, I do have it. I just have longer arms and legs than the average person with achondroplasia. And so yeah, it's always, it's kind of always, it is always a little funny when, you know, when I mention it and then, someone's like, oh, I didn't realize. And so that is kind of always a little funny. But, I kind of sometimes like that. I've always, growing up, I never shied away from the fact that I had achondroplasia, but I was just always like, why does it matter that I have achondroplasia? Like, it was all ever, anytime even being a little kid, it's all anyone ever wanted to talk about, and about the fact that, oh, she has like, you have achondroplasia, like, whatever. And I'm like, and then ask me questions about how I do things and whatnot. I'm like, I just do it. Like, I've always have found it.
People,
I'm sorry.
yeah, I mean, it happened in the disability community a lot. I don't know. I just see people are just curious, and especially like you seem like a outgoing person, like they want to like talk to you about it. I don't know. It's just a curious thing.
No, yeah,
I know it's
no,
pretty.
definitely.
I know it's invasive. I do understand that it's like invasive. Like they did that. Like you don't ask about someone's like I don't know like weight, like that kind of thing. But I don't know. It's like a weird, but at the same time, it's also up to the person. So it's like, hey, I don't want to talk about it. But I've definitely been in a situation and be like, I'm just gonna change topic because I don't want to talk about myself, like especially where like at a wedding. So
Yeah. No, definitely.
yeah,
I've
I
always
guess.
been very, um, you know, happy to answer questions when it comes to like things.
Yeah.
But I think sometimes there would be questions where it's literally like how do you do whatever, and I just would say, well, I just get dressed in the morning, and they're like, but like how? And I'm like, just the only way that I know how, because I didn't have any, like, I don't have anything else to compare it to, and so I,
I guess.
sometimes I feel like when people ask people, disabled people or people with disabilities, when someone's asking them questions about like their life or whatever, it's always, very great if they're just trying to get that information. But then sometimes, like, I've had people who kind of clearly didn't like wanted to get more details and didn't quite understand. Like, I've been living with this
Yeah.
condition since birth, so I literally don't know any other, like, it's not like it
Mhm.
just randomly happened one day and then everything in my life
Yeah.
changed. I've had it since birth, and so this is how I've just always lived my life. So I have nothing, to really compare how I do things to, like, obviously I knew, like, oh, I have to use a stool in the kitchen. My sister doesn't. Like, but still, using the stool was my norm, and so it was just like that
Yeah.
kind of thing.
I think you're also in a unique position where you kind of have like I don't know if you would say new body, but like I guess an upgrade to yourself, like stuff that you did before. Like now, like before it was a struggle, but now it seems I'm just assuming that's just more normal. Put like a shirt on and like reach out. Like now you don't need. I'm still pretty sure you need a stool for like I guess the middle or even the top shelf because it's so high up. But
Yeah,
like I feel like so many of your problems got eliminated basically like
they did.
from the beginning.
They did. It was so much more than just gaining height. Like, so many things just,
Yeah.
in a way, so many things just like went out the window. Like, everything that I just struggled with physically and everything by going through limb lengthening, it's like everything that I struggled with was just like I haven't seen it since, and it's just been great. Like, I do use, like, I still, in my apartment, I can only, on my cabinets, I do have to use a step stool to get onto this, to get something off the second shelf, because I don't know what is it
Yeah.
about architects who have built, apartments starting in like 2005. Everything is like made for people who are 6 feet tall. But,
Yeah.
I do have to use a step stool in my own apartment just to get things off
Mm.
my, or, off the second shelf in my cabinets. But, I mean, still, I don't have to use a step stool to get something off the bottom shelf of the cabinet, and that's
Hell
really, I
yeah.
mean, that little thing really has just, like, yeah, that has been a great, like,
Yeah.
just that little thing alone had, changed everything for me.
I guess why like people give you shit for the surgery, but like it's such a hugely beneficial surgery for you, and you only live once. Like if it's something you can do to improve your life for like forever, go for it. Unless there's some long term health damage that I just don't know of. Like, well, I guess a good question would be is since it's such a drastic. You got the surgery when you were 16, right?
Yes, technically, I guess 17 is what. So I had my surgery, you know, in August, and then I went through the treatment from August. The first one was from August to April, and I turned 17 that November, so I was 17 for the majority of that treatment. But
I'm just kind of gonna make the comparison to like going through trans sexual surgery. Like, so like you need to go to like therapy and like talk to doctors and make sure like you're like mentally there before you start making changes. Is this similar to the limb lengthening because that's just a huge deal? And I also surprised that it starts at 17 because I feel like you're still growing a little bit even to like 21. I thought you would wait till you stop growing and then do the surgeries.
so for me specifically, I knew I was done growing because I had already been through puberty. And so
Okay.
for, and I know males are a little like the male anatomy is different, but for
Mm-hmm.
me, I was done growing. I hadn't grown in however long. Like I was done growing. I was at my adult
Ah.
height. But for limb lengthening specifically, especially kind of I would say in the pediatric space, it is just kind of like a very specialized orthopedic treatment. Yes,
Mm-hmm.
since I was 16 and I was older and I, understood so much more about the world around me and everything that went into it, into the treatment, I was very much able to, have, make that informed personal decision and, knew myself, what came from it. And every physician that I know who performs limb lengthening specifically for skeletal dysplasia, dwarfism, achondroplasia, they're all, similar. They're not just going, they know, they understand that this is kind of someone with achondroplasia going through this, or dwarfism, there is controversy that kind of goes with it, and they always make sure that the patient is and that understands the commitment needed to go through this and understands
Mm-hmm. Yeah.
that they're fully committed 100%. My doctor, I've had endless conversations with him where he has said, with any of his like patients in his practice, has said, I'm you know, unless the patient is, until the patient is 100% committed and understands, like, I'm just the doctor who does the surgery, and, I am the orthopedic surgeon. I want them to be 100% committed to this, and I'm not going to pressure them one way or another.
Yeah.
But what I really enjoyed about my first initial appointment with him is he, looked at it solely orthopedically and alignment. He was like, my goal is to make sure, we, because regardless of if I wanted to go, like, regardless of if I ever wanted to do limb lengthening or not, my legs were so severely bowed. Like, I needed them to be straightened, which is a very common procedure. So many people with achondroplasia have their legs straightened due to the bowed legs. And I mean, that's not controversial, that's just a common procedure. And so, his number one goal was making sure, hey, we're making sure your hip, knee, and ankle are aligned. Like, that's my biggest concern. That's what I'm here for. And if you want to, go through the full and lengthening, like, let's do that. But that's 100%, your decision. And obviously, I'm here for you to go through that. I never have felt pressured from my physician or any physicians, have never seen them pressure patients with achondroplasia to go through limb lengthening because it is such a very personal decision. And so I just really appreciated the fact that, he was just kind of let me fully in charge. And so, but because limb lengthening so for achondroplasia, the youngest it can be performed is like age 8 to 10. However, they are not, when they perform it at that young of an age, they're not, like, their main goal is not height, it's function and making sure the joints are aligned and everything like that. It's not like making them be a certain height because they want to be taller. It's like fully for like limb alignment health reasons. And so, and that's with any like orthopedic condition that they treat because limb lengthening is a treatment for many other skeletal dysplasias, orthopedic conditions overall. And so I think that's just very important to note because I think a lot of people, when they hear limb lengthening, they only think of, oh, everyone who has it is getting taller. And that's not the case. People who have, one leg shorter than the other have limb lengthening on their one leg that is shorter than their other leg to, help to even the alignment in both of their legs. And so there's truly so I mean, it's just an orthopedic procedure, and it is, it's uncommon with the skeletal dysplasia community, and it can be very controversial, but the doctors in the US, I know, who perform it they're great about being advocates for the patients and not forcing them any way, shape, or form to go one way or another to do it or not to do it. They're just kind of in a way along on the ride and let the patient lead, take charge of that and decide how far they want to go. And I was very fortunate that that was my experience every time, like every follow-up appointment that I had with my doctor while going through my first lengthening. I knew the max length that I could gain, but still with every appointment, he would ask me like, are you still good or do you want to continue going until, you get however many centimeters in your femurs, however many centimeters in your tibias. I was like, I want to keep going until, it can get the most that we can with this segment. And so, that's one thing I'm a huge advocate for is when patients or families are considering this treatment option to make sure you're going to one, an orthopedic specialist who is not only specialized in limb lengthening, but is specialized in limb lengthening specifically for dwarfism and skeletal dysplasia. And within the United States specifically, there really are only two institutes that are the go-to place. And so anytime I meet someone who has gone through limb lengthening but did not go through it at one of those two places, sometimes they're having like a little bit of complications with it. And because their physician they had a great physician who, wanted to help them and wanted to provide the patient with the care that they wanted. However, they were not too familiar or specialized in this particular treatment for achondroplasia. And so it's definitely very important when you have skeletal dysplasia to go through and you want to go through limb lengthening, to really go to a physician who is an expert in both that treatment, but specifically for achondroplasia, hypochondroplasia, and everything. Not every form of skeletal dysplasia can go through limb lengthening due to how maybe their cartilage or their bones or their joints are, but those with like achondroplasia or another um, condition called hypochondroplasia are the most common to go through limb lengthening. There's a few others, but yeah.
Yeah, I'm just surprised there's not like everyone in the disability community always like wants, like if there is a way to like improve your life, they're gonna do it, regardless of the risk. And there's like this proven way with like you, it's proven that helps you with a lot of the height, but like physically and such. So I just feel like it's weird that it's not a popular surgery to get because it's like a surgery that's not there. It's, like there's proof that it does work and such. So I'm just surprised people are so against it to like help, especially if there was no medicine available to treat it.
Mhm.
Like I'm just surprised people would just be like, no, I don't want it.
Yeah, I think a lot of people, and I respect those who don't want to go through it, but I think a lot of people just, there's the disability community as a whole, but just since I'm within the dwarfism community, that's the best, comparison I can use. I, think a lot of people are so much of their identity is having dwarfism and either being a little person or a dwarf, however they want to identify. And I think for me, that was just never like the fact that I have achondroplasia is just part of me, but it's not my full entirety. It's not everything that makes me me. And I think a lot of it comes down to, you know, in a way, how they identify. And, for some people, having dwarfism is to them being a dwarf or being a little person. And that's a huge part of their identity. And for me, it's just always been a condition that I have. It wasn't so much, I mean, obviously it's a lifelong condition and have it for the rest of my life. And it is a huge part of my life, but it's not my entire, like, I don't let it necessarily be the
Oh,
main focus of
yeah,
my
fuck that. Like, why people? Yeah, that's fuck that. Like, why? There's a chance to make yourself 5 inches taller and like not use a step stool. Like, you're so ego. You have such an ego that you want to be like this. Like, it's really good glass to break to help yourself. Like, do it. Like, I don't. Maybe they're mentally ill if they just want to stick in that hole. Like, do it. Like, make your life better. Like, what are you waiting for? You're just gonna sit there and do nothing? Like, I don't get those people. It's weird.
Yeah, and I think,
Like,
something I also always like to say is, especially for those who are so against it, which is understandable. And, I've had people say, oh, I shouldn't be a role or an advocate or whatever. That's fine. I don't care. But, I have, because it's not going through limb lengthening, because it's not the average norm for someone with achondroplasia, and I'm not, representing achondroplasia well because I went through it. I don't know. At the very end of the day, regardless, I could not tell you how many people in the world have achondroplasia, but whatever. Yes, I am someone with achondroplasia, just like thousands of others around the world. And however, I'm Chandler before I am somebody with like before I'm a person with dwarfism. Like I am Chandler first, and so I do, what's best and what's best for Chandler, not what and if that's not the standard norm of what someone with achondroplasia goes through, then okay. But like whenever I do anything to my body, I'm not doing it to an achondroplasia body or achondroplastic body, I guess is technically the more correct way to say it. I'm not doing it to, somebody with achondroplasia. I'm doing it to Chandler. Like that's how I see it. And so, it just always like to me, I think no matter if you share the same diagnosis or same condition as one, two other people or 200 or 2 million other people, what you do for your own benefits or anything is just your life and your decision. And like, so what if you're the only one who goes through it? It's not a representation of the, condition as a whole. I don't think there's one, you know, I think sometimes, especially, and again, I can only really use achondroplasia or dwarfism, like for, sometimes you think about the typical American family, like a beaver cleaver, leave it to beaver family, whatever. And I mean, that's not the average American family. And so there's also not like an average lifestyle for someone with achondroplasia because I just see us as all as kind of the same as any other person in the world. Like we just all have our own lifestyles, but we might just share the same condition with however many other people. But there's not like this one, like just standard lifestyle for like that you have to live if you have achondroplasia. Because I mean, we're all in our own elements of, in our own house, in our own neighborhoods, in our own cities, in our own states. And so it's just like, I think that like representation does matter. And as a advocate, I understand the role that I play when it comes to advocacy and awareness, but also at the end of the day, like I am just living life as Chandler, and my goal is to provide resources to anyone and just information, but those people can take from that. But I don't want someone that even parents or patients or individuals, not patients, but individuals with achondroplasia who reach out to me and ask about my experience, I share it, but I tell them like, but don't like let my like, just because I went through this, like I don't want it to, be the deciding factor for you, but also don't let, you know, someone else who's the complete opposite of me, like be the deciding factor. Like you make your own informed decision with the information that, you have. And so, I don't know. It takes, no, no.
Like I'm just like trying to think of an opinion. It's like it kind of like I think they're like insecure and that they think they're so attached to their diagnosis,
Mhm.
which I feel like is a shame because it happens a lot in the disability community, and I'm just like not really healthy to do,
Mhm.
and there's a way to, help yourself and make your life better, like go for it, like just because everyone else not doing it doesn't mean you should like be hurt and you hurt yourself while everyone else is hurting. Like if you can help yourself, like go for it. So be selfish about that. I think that should be more applauded for.
Yeah.
But it's also weird because like limb lengthening surgery could be a sign of insecurity, but like kind of it's like weird. Like you're insecure that you don't get the surgery, but you're also insecure if you do get the surgery because you're obviously making your life better, but it's not an insecurity.
Yeah.
I don't know. It's kind of like I don't know. It's like a weird thing. Like you have to be secure enough to get the surgery because you're like losing the one thing that people, I guess, put a finger on you. But I think this is bullshit. I think you're just a person and you should just do what makes your life better. Like I was thinking grow 5 inches. That'd be dope, But like it wouldn't improve my life as much as it would for you. Like that, you like I don't know, like fuck them that they make your decision feel like shit. Like you know, like go for it. Like if you told me like, hey, I'm gonna get limb lengthening surgery, and all that, I'd be like, hell yeah, like go for it.
Yeah.
I mean, it's just I get like just reading from other testimonials. Is it as painful as they say it is?
Is uh
Is it like the limb lengthening, like the whole?
it's honestly
I don't even know how long does the limb lengthening. How long does it like the whole? Let's say from surgery to like the end, like where they take off the braces. How long does it like? How long is it? Like a 2 year process?
so it can vary, but like so for me specifically, since I was 16, I was older, my growth plates were closed, and because my growth plates were closed, we were able to be, or I was able to be a little more aggressive with the treatment. So with my first lengthening, I gained
Yeah.
6 inches in height. So and that's lengthening 3 inches in the tibias, 3 inches in the femurs. And so I gained, so upper leg, lower leg, whatever. So I gained 6 inches in height, which is not, so someone who's younger and whose growth plates are still open, they are not aggressive with treatment like that at all. And
Huh.
so, but however, I, in my personal experience, I was 16, 17. I was a female. Girls, I think in general, kind of grow bone slower than, or I guess the female anatomy, whatever, grows bone slower than than males do. That's how it was for me. It said that to me.
Yeah.
Someone said
Didn't
that
they
to
have
me
more?
once.
I think they have like more torso or something. I don't know. I mean, I'm sure you can see the picture in the back of the women's anatomy
Uh-huh.
to help you out.
Yeah.
Yeah. Yeah. I don't. Yeah. I guess they have a longer stomach. I guess. I don't know how it works,
But
but
regardless,
too
I
bad.
so my first lengthening was from August 24th, 2010 is when I got the frames on, and then April, I remember I got my frames off like the week before Easter, or like the week of Easter. Like Easter was that following Sunday.
Yeah.
So it was from August to April. However,
Oh.
my
Oh, that's short.
yes, but it was also a much
Oh.
very different experience compared to my second leg lengthening. So after my first lengthening, I had
It's multiple. Oh, I thought it was just like one. Oh.
no. So my
Yeah, I
first
thought it was just like one
lengthening,
and
I
go.
only was from so that was from August 2010 to April 2011. And so I went from 310 to a little bit over four. I was like 4.5, 3/4. You can say 4.6, whatever. So I was 4.6 for a while before I became 4'11. So I went
Man,
so that was
your ego must have been through the roof, like the halfway point. Like, holy shit,
so and I
this
could
is
have ended
great.
there, like I could have stopped there, but then I had the frames removed and everything. I finished high school. I lengthened my arms and lengthening your arms, it's so easy. You're not like your restrictions when you're lengthening your arms is like, please don't carry your laptop or a heavy plate or pick up things heavy or put whatever. Lengthening arm lengthening is honestly such a breeze. It's ridiculous. And so arm lengthening for me was from January 2012, and this is just the time frame of when I had the what are called fixators on my body. So that was from January 2012 to August 2012. So that was 8 months. Arm lengthening, in hindsight, does take a little bit longer because the bones take a little bit longer to grow. When you're doing your leg lengthening, or when anyone does leg lengthening, you can stand and you can walk when you're going through it, especially like in physical therapy. I mean, it is very important. And so when you can bear weight on your bones, it helps to stimulate bone growth, and so that helps with bone consolidation. However, with
Yeah,
arm lengthening, you don't. I mean, in general, you don't bear weight on your arms a lot. And so that's kind of why arm lengthening sometimes just takes a little longer just because it's for the bones to grow, but it's not that it's like, it's still easier. It just kind of takes a longer process. Now, with my second leg lengthening, I still needed a little bit of deformity correction. Like there was still just a little bit of bowing that needed to be corrected. So I did have the external frames, the external fixators on my tibias again. However, I now today, and that was, sorry, this was in 2013. So 2013 is when I had my second leg lengthening. And that's when I went from 4'5", 4'6" to 4'11", the height I am today. And so with that lengthening, I actually had an internal rods in my femurs. So they put actual rods in the bone of my femurs. And since they were internal, there was nothing externally there. And so that was a world of a difference. It's less invasive. There's no, you know, external, like nothing coming out of your body. And that and internal lengthening really has been such a game changer. But so with the internal lengthening, but still with that lengthening, it was kind of the same timeline. It was so that was from May 2013 to I think January of 2014. So it's still about the same timeline, but so my end goal for that lengthening was making sure my tibias, which is where I had the external frames, were consolidated enough to have the frames removed. And so the internal rods, I couldn't even feel them. The internal rods that were in my femurs, I couldn't even feel them. Like they caused no problems whatsoever. But they stay in for about, and this again was how it was in 2013. I think so much has changed since then in terms of like protocol and whatever. But so I
Yeah.
had those rods in my legs for about a year. But again, I didn't feel them. I was like up and like, you know, I was walking, doing things, whatever. Didn't like they were in my femur, but I mean, I didn't feel it. The same way, you know, anyone who gets any sort of metal implantation anywhere in their body, like, oh yeah, they're just on living life. Like, you know, they didn't, because they were in my femur, they didn't bother me. So I was able to like live life, whatever, with them in my body for about a,
I mean, it must have felt amazing just getting even 2 inches of height, let alone 5 inches.
yeah. So
Like, holy shit, that must have felt amazing.
it, you know, I remember after my first lengthening, when I went from 310 to 4'5", 4'6", that was a huge world of a difference. And it was great. And then I decided, I was like, you know, I do want to do it. I do want to do it again. I want to go through it again because I knew I could get another 6 inches. Four,
Hell yeah, go for it.
4'5.5" to 4'11" was world of a difference. Like 310 to 4'5.5" was a big difference, but the last lengthening, I mean, really, it just was like, oh my gosh, like it was unbelievable, and it was just, you know, amazing. And I know so many people who only have done one leg lengthening and they're so happy and satisfied. And so, you know, it's all about just what you want and your best, you know, what's best for you.
I mean, if you're going through all that trouble, you might as well get the maximum, I guess, healthy height you can get, just because,
Yeah.
you know, like, once you start and you stop, you're not really going to do it again, so you might as well do it in one, do everything now, and then, I don't know, like, and if you ask anyone, would you increase your height by 5 inches? Most people would say yes, unless you're like 6 feet and taller.
Yeah.
But otherwise, I think most people would say yeah. So like, I don't know. It just blows my mind. People would give you shit for getting surgery, and it's like, really? Like, you wouldn't want to be 5 inches tall? Like, what world are you living on? Like,
Yeah.
I'm up here and you're down here. Like, don't talk to me.
Yeah.
You know? Yeah, it's great. Like,
Absolutely.
I mean, you have no regrets about the surgery.
No. It was truly the best decision I've ever made in my life. Like if I had to do it all over again, I would 100% with no hesitation.
Yeah, I mean, I think more people should listen to your story and just go for it because, YOLO.
I
Like,
know, like you do. It's true. You only live once. Like why, you know,
yeah,
if you only live like if I knowing that you only live once, I wanted to live in the body that I wanted with the life that I wanted, and I didn't want to just always think about what could have been had I, not gone through it.
well, I mean, I know we've been talking a lot of the positives, which is great, but like, are there any, I guess, negatives? Well, I guess you were dealing with negatives before the surgery, like the bone, but like, do you have any new negatives that you have to deal with now that you weren't before?
Honestly, no. I mean, there's like I really don't. Like I would say,
Oh,
so much of my life did change, but also so much of it did just remain the same. Like, but I have no negative experience from going through it or even just today. I mean, it's been 10 years since my last surgery. And so, there's never been a day where I'm like, oh my God, I wish I hadn't gone through it. Or, just no, like, there really have not been, any negative things from it. Now, have I had bad days in general and, from achondroplasia and whatnot? Yes, like, definitely. But nothing that was caused by going through limb lengthening. And so it's still like best, like for me, it's just there's not been any negative negativity from it personally in my experience, but yeah.
I mean, I'm great that everything worked out for you. Like, well, it's been 10 years, but like, yeah.
It's
I
crazy
mean,
to me. I don't believe that it was 10 years ago because it literally feels like it was just like a few years ago. Like it's crazy. It really is
yeah.
crazy how far, like how long it's been because I also just have a very vivid memory. And so it's just like I can remember specific days that I feel like, oh, that was just like last year. No, it was literally 10 years ago. And so it's crazy sometimes when I tell people like, oh, like I haven't lengthened since 2013, 14, but yeah, it's crazy.
I guess like a height is also a thing where you can like pretend you're shorter and you can like, but I'm sure like you appreciate every day of just being taller. Like something in your mind, like you were shorter, but you're taller. That like you
Yeah,
like I know you probably
that's
like you still think about it like nonchalantly, but you still think about like I'm sure you think about like I don't know if you're reaching a shelf or like sitting down. You're like
it's really
like
ironic
I was shorter
because
at one point.
it's
Yeah.
it's really ironic because like when I before lengthening, I didn't like the fact that I was so short and whatnot. Like I didn't own it, whatever, but now I make the fact that I'm 4'11" and petite and whatever. There are days where I make it my entire personality that I am so short. Like I literally just sent a meme to one of my best friends yesterday. It was like two animals and like, you know, one was I don't know, I can't remember what the exact animals were, but like one was a giraffe and one was like a penguin or something. And then it was like there's always two friends where one's like really tall and one's really short. Like I am so like there's so many times where I make being short now my entire personality. And like I know that's really ironic, but it's true. And I think because I am, you know, because I'm in a place where, my body is the body like that I'm wanted and that can do the things that I wanted to do, and just the body that I feel like I'm supposed to be in, rather than the body that I was in at 3 feet 10. Like being 4'11" is like sometimes just my entire personality. Like, and it's also weird because, there's still times where like if I'm at a store, I might have to ask for something off a higher shelf, and like when I ask, I'm like, well, because I'm like so short. Because it's just like, like I don't know, but like when I was 3'10", like I didn't want to like draw attention to the fact that I was so short. But now I'm like, yeah, I'm short. I'm 4.
So ironic.
I can't explain it, but it's so true.
Okay, I totally get it. I don't know. I yeah, I know. I get what you're trying to say, and I'm trying to find a definition for it, like a term for it.
Yeah,
But I don't think there's a term for it except like irony.
yeah,
So
it's
it's
true.
ironic.
No, it's totally true.
So before I take the mic away from you, is there anything you want to say, promote, any words of wisdom, the winning lottery numbers? The mic is all yours.
Oh gosh, I don't think so. I really enjoyed this. I can't think of anything like off the top of my head that I hope people take. I mean, I think my biggest thing for whatever I want anyone to take away is, when you meet someone with achondroplasia or any disability or any condition, don't just assume that they're going to have the same exact, I don't know, lifestyle or opinions or, thoughts or whatever as someone else with their exact same condition. Like we're not all like we all share the same, if it's achondroplasia, like we all share the same diagnosis, but we aren't all the same person. And I think sometimes so many people are just assume like, oh, every person with achondroplasia thinks the same, looks the same, feels the same way, and that's just not true. And I think, and I understand they don't ever mean like anything by it. It's just whatever. But it's always just like important for me to be like, I'm not the same as anybody else. I'm just Chandler. I'm not the same as, just remember we're all still individuals in our own way.
Oh, so thank you, Chandler, so much for giving me your time and expertise. Thank you everyone for listening and watching, and everyone follow Chandler. All her links for her social media will be in the description below. I'll see everyone next time. Bye!
Thank you. Bye.